Good morning, everybody. I'm joined by Dr. Ann Schuckett from the Centers for Disease Control and Prevention, and Gail Rosides, who is the acting administrator of the Transportation Security Administration. As you know, the holiday travel season is upon us. That means that it is time for travelers to start thinking about preparing for what will be significant increases in passenger volume over the next week and the weeks to come, especially at our nation's airports. So today we'd like to provide some tips on how to make your holiday travel experience as smooth and efficient as possible so that travelers are ready for the screening process before they arrive at airports, which will help improve the process of security at the checkpoints. So that our transportation security officers can keep the lines moving swiftly and securely, and all of us do our part to be alert and report suspicious activity to the appropriate authorities. Before we do this, however, we want to remind everyone that part of safe holiday travel includes making sure that we all practice good hygiene and do our part to prevent the spread of the flu. The H1N1 virus is still very much with us, and we don't expect it to slow down anytime soon. No one wants to be sick over the holidays, so we need everyone's help. It's a shared responsibility in preventing the spread of the flu, especially during next week for Thanksgiving and over the next month for the holiday season. So how can you help? By doing what we have been asking Americans to do since the H1N1 virus first appeared. Cover your cough or sneeze, wash your hands regularly, and stay home if you are sick, especially if you have flu-like symptoms like a high fever. Be courteous. If you think you have the flu, stay home. Get well before you return to the workplace. Now, whether you're a frequent traveler or on occasion someone who only travels a few times a year, there are several things you can do to make your travel experience a smooth one and also help our transportation security officers get you through the checkpoints securely and safely. First, make sure that your identification and boarding pass are out and ready. Getting all travel documents together and ready before you get in line will help security officers quickly verify that your identification, and your boarding pass match and are valid. Second, wear easily removable shoes and jackets. Wear footwear that can be easily removed. That helps speed the process for the x-ray screening. And be prepared to remove all jackets and other outerwear because they need to be screened as well. Take out liquids and laptops. Remember the 3-1-1 rule for liquids, gels, and aerosols at the checkpoint. 3-ounce or less bottles for all liquids, gels, and aerosols, 1 quart-size clear plastic zip-top bag, and 1 bag per passenger placed separately in a security bin for x-ray screening. The liquid restriction applies only to carry-on bags. Passengers can carry larger quantities of liquids and gels in their checked baggage. And be prepared to remove your laptop from its case and place it in separate bins for x-ray screening. Next, use Tsa Family Lanes if you or your family need extra time or assistance. Last year, TSA expanded its popular family lanes to every security checkpoint in the United States. Family lanes allow infrequent travelers, those with small children, or passengers who need additional assistance to move through security at their own pace. Officers in these lanes work with passengers to screen medically necessary items like baby formula and insulin. Next, keep an eye out for suspicious activity. Transportation security is a shared responsibility. The traveling public can play an important role in keeping travel safe this holiday season. This is especially true when we realize that our nation's transportation network is an essential part of our critical infrastructure and key resources. A disruption or emergency at any key point in our transportation system could not only mean a tragedy at that location. It could have a powerful ripple effect that impacts national security, economic vitality, or simply disrupts the lives of millions across an entire region or the country. This is something that we will be discussing in greater depth over the next month with our focus at DHS on protection of critical infrastructure. But again, protecting these shared assets is a shared responsibility. Everyone has a role to play, so we ask the traveling public to remain vigilant this holiday season and to report suspicious activities or items to security personnel. Finally, when booking your next vacation or business trip, remember our new Secure Flight program. This program fulfills a 9/11 Commission recommendation. TSA is working with airlines to phase in Secure Flight, which is a behind-the-scenes program that pre-screens passenger data against government watch lists for domestic and international flights. This makes travel safer and easier by keeping known or suspected terrorists from obtaining a boarding pass. Secure Flight also helps prevent the misidentification of passengers who have names similar to individuals on government watch lists. So when booking airline tickets, use your name as it appears on the government ID you use when traveling, along with your date of birth and gender. Let me emphasize that again. When booking your airline tickets, use your name as it appears on the government ID you plan to use when traveling, along with your date of birth and gender. Providing this information clears 99% of passengers. We have built flexibility into the process. So if you're not prompted for this information when booking travel, or if there are small variations between your name on your ID and your boarding pass, don't worry, you will still be able to travel. So I want to thank everybody in the traveling public for doing their part this holiday season, following good hygiene for H1N1, recognizing that security is a shared responsibility, and taking some common sense steps to move swiftly and efficiently through the procedures that we have at our checkpoints. So with that, let me stop and ask Dr. Shukett to provide an update on H1N1.
Thank you, Secretary Napolitano. It's a pleasure to continue our partnership with Homeland Security to help keep the American public healthy and safe. And I'm delighted to be here today. As a very frequent traveler myself, it's really important for us to travel well. There are a lot of events coming up over the next several weeks that'll have people traveling even more than usual. And when people come together, germs can come together too, including the flu. And so what we're trying to do today is help launch a Travel Well campaign to help keep us healthy and safe as we're traveling and do our parts to reduce infections like the flu. Travelers can take many steps to reduce illness in themselves and to prevent spread to others. And so I am truly excited to be part of this campaign. Today we're launching a campaign that has several parts. It's going to have the theme of helping travelers stay healthy. Our campaign's going to run until early 2010. It includes posters in airports, seaports, and border crossings to remind travelers of things they can do. And we'll also have a national print, radio, and online advertising component. We're also using new social media to really help spread the word to all kinds of folks. The two major themes you can see on our posters: prevention can be travel-sized, and people should stop, wash, and go. We're looking for a jingle for that stop, wash, and go, but all ideas are welcome. The campaign highlights 4 important steps for staying healthy: traveling only when you feel well, washing your hands often, covering your cough and sneeze with a tissue or your sleeve, and getting a flu vaccine if you're in a group for which it's recommended when it's available to you in your community. Today, I'm happy to announce that we are up to 51.9 million doses of H1N1 vaccine that are available for the states to order. We're excited we've crossed the 50 million mark. We know it's still not enough, and many people are looking hard to try to find vaccine in their own communities, but things are getting better every day. One of the most important things that people can do is to travel only when they're feeling well. You know, we've issued recommendations that if you're feeling ill, if you're ill with fever and cough, you ought to stay home from work or school or from travel until 24 hours after your fever has broken. This is prudent. Even if it happens, even if you get sick while you're traveling, it's best to stay where you are until your fever's gone for 24 hours. So spend a little extra time with the in-laws and the relatives. That might be the best thing for everybody. There are not that many studies about flu spreading on airplanes and trains, but anytime people are close together, there's a possibility of germs spreading. And so there's some things that you can do if you're on an airplane and somebody on the airplane is sick. You know, things you can do include washing your hands or using a alcohol-based hand sanitizer to protect the spread of germs. Don't touch your eyes or nose because you can actually get yourself infected from that way. And if there is someone coughing away on the airplane, you can ask a flight attendant whether it's possible for that person to move to a less crowded part of the airplane. As we do throughout the season, we're reminding people about those basic hygiene steps that you can take. It's, as Secretary Napolitano said, this is a shared responsibility. All of us can do our part. So washing your hands, covering your cough or sneeze, and of course, not traveling or traveling only when you're well. So our campaign has a variety of elements. We're reaching out to travelers in different ways. Our posters I look forward to seeing later today, I think, at the airport where I'll be going. But our posters are going to be in airports and on land border crossings between the U.S., Mexico, and Canada. We'll have print, radio, and online advertisements, and again, the social media. And we have a lot of collaborations going on with local health departments, which often will run the posters and the campaign in the travel clinics serving their communities. Lots more information is at our website at CDC, www.cdc.gov/travel. Great travel health information there. So holidays are a time for us to get together with family and loved ones, and nobody wants the flu to ruin your travel or your holiday spirit. We know that flu, especially the H1N1 flu, is on people's minds this year. It's been a big concern, but it should not ruin your holidays. By practicing a little bit of prevention, everyone can enjoy their holidays and stay well.